So how do we measure fatigue? We need to be able to measure it in order to study it a little bit better. So there are subjective measures, and these are probably easily performed in a clinic basis. So if you go to your doctor, that might be something that's easy to perform, or something that you can do yourself at home. And these are self-reported scales. The one most commonly used in medicine is the fatigue severity scale, and I've shown that there. We were the first ones to use that in mitochondrial disease, but it correlates very well with the fatigue impact scale, which is the longer one you see there, which has been used in Mito in the past. So either of those scales has validity in the population, and that's how we measure subjective fatigue, or how you interpret your fatigue. Objective fatigability is sort of more, what are your muscles doing, and how is your physical function. We like to do things that are easy and translatable to the clinic. So we've incorporated sit-to-stand tests in the studies that we've done, mainly for that translatability, but also because when you do the research on what is muscle fatigability, these isometric extension sort of exercises have some previous sort of validity in assessing that. It also, the sit-to-stand test is a test where you see the picture down the bottom. We just get the patient to stand up repeatedly. It's not just muscles that are important there, so it's also your balance and other, neurological components, in addition to just frailty and joints and other things. So it's a test where, as you age, the time taken to do it actually is a bit longer. So it has to be an age-relevant comparison. There's also sort of functional tests like 6-minute walk test and 12-minute walk test and things like that, where they measure how far you can go in that time. That's actually a really useful test, and it's been translated into more recent clinical trials on medications mainly to do with mitochondrial myopathy patients, can we make those patients better? And so it's a test of fatigability that will have relevance if any specific medications come out to treat those types of problems. And there's tests of cognitive function, just because cognitive fatigue can be a different component. Exercise performance testing is something that was traditionally done in mitochondrial disease. You see down there, there's a man that's strapped up to an ergometer. That's a bike where he exercises, and it measures how much CO2 is coming out, and oxygen and heart rate and cardiac output and other things. So how your body copes with exercise and how much oxygen is exchanged, and how efficient that process is, relevant to mitochondria, because it's, the core of the mitochondrial function is related to energy production and oxygen use. But it's a very difficult test to perform, and you need a really, a formal setup in a big lab. You can see they've got all those computers there and trained personnel, so it doesn't really translate to a day-to-day clinical practice.